Where I'm Dr. Georges Benjamin, and I'm the Executive Director here at the American Public Health Association. I've been here since December of 2002, so I'm in my 15th year. And I came from being the Chief of the Department of Community Medicine and Ambulatory Care at the City Hospital here in Washington, D.C. And I was frankly minding my own business one day, and my phone rang, and the mayor was on the other end of the phone, and he said, have I got a job for you? And it's been going well ever since. Well, our goal of achieving becoming the healthiest nation is built on the fact that we like to measure things. And for many, many years, we have measured our well-being in this country compared to other nations. And despite spending an enormous amount of money, almost twice as other industrialized nations, we're almost at the bottom on health outcomes, whether it's infant mortality, or cardiovascular disease, or cancer. We're just not doing well at all with many other nations. Having said that, we think, again, there's something we can do about it, and this is a leadership exercise. This is about focusing our resources and changing the way our society thinks about health so that health becomes a measure of success in all aspects of our society. And so APHA is trying to really work with all the aspects of our health community to make that happen. I believe the most pressing challenge for the public health community in the future is clearly climate change, and particularly climate change as it impacts our health. It is the one thing that affects every aspect of our lives. It affects infectious diseases, it affects the way we build our communities, it affects food sources, it affects rights and health equity. Many of our most vulnerable citizens on this planet get the worst outcomes from climate change and contribute the least to the problem. So it's a big problem for us. And I think public health has a unique role, particularly on the prevention. There are many things that we can do to reduce our carbon footprint, to improve our health and address climate change. Well, we've certainly been a strong supporter of the Affordable Care Act. When the Affordable Care Act was being conceived, we decided that we wanted to focus like a laser on the prevention and wellness provisions of the ACA. The reason we did that was we recognized, again, that there were many people talking about health insurance coverage and a range of other things around the ACA, cost, quality. We wanted to focus like a laser on the preventive medicine aspects of this, because we thought that was clearly where we have our strength. And so we did, and we were very involved in making recommendations around funding it, making recommendations, for example, for the Public Health and Prevention Fund. And what we've done in terms of our advocacy now that that law is under threat, is we've worked very hard at trying to explain it to people, explain the benefit of prevention and wellness. Trying to get our members to engage their resource allocators in a variety of phone calls, emails, texts, to let them know that the Affordable Care Act actually, in its totality, is actually working and is doing what it's supposed to do, saving lives, reducing morbidity. We brag a lot that our best work is done when nothing happens, and that's true. And we have not been very good at telling that story. In the military, if there is an airplane crash, they ground the whole fleet, have an intense investigation to figure out what's going on, fix it, and move on. But then they tell their story. And public health needs to do more of that. So when nothing happens, we need to tell people, yep, you didn't get sick today because your water was safe to drink because of we did this. And when something does happen, we need to remind people where the breakdowns occurred, because every day there's a foodborne outbreak somewhere. There's a vaccine preventable disease happening somewhere. And we go dutifully to address the problem, but then we don't remind people how that could have been prevented. So there are ways to tell the story, we just haven't done a good job of it. I think that remind everyone that we're a collective, that public health is a team sport. And there's an education component to it, there's an advocacy component to it, there's an educational component that is very different from in the future than we've done in the past. And I just look forward to the next many, many years of public health.